Good morning, everybody. My name is Dr. Venugopal Kulkarni. I'm one of the vascular and endovascular surgeons here at Care Hospitals. Today, I'm going to briefly discuss about how you take care of your feet in patients with diabetes. Diabetic foot is a very common and a very serious condition. Every 20 seconds, somewhere, someone in the world is losing their limb. And when I advise patients to take care of their feet, they wonder, what do you mean by taking care of my feet, doctor? Here I'm going to tell you briefly what you need to do. If you are a diabetic and if you are over 40-year-old, you got to inspect your foot every day. When I say inspect your foot, you look at your feet carefully. Start from the nails, how the color of the nails, texture of the nails, whether you've got any ingrowing toenails, and looking at the shape of the foot. Is your foot is normally the shape which used to be, or have you noticed any changes in the shape of the foot? Have you noticed any cuts, cracks, ulcers, bruises, any color change, any swelling? Most of the patients have got what is called as neuropathy, where they don't feel anything. So unless you look into it, you don't realize that you have got a problem in your feet. And even well-educated people, they are not aware of looking at their feet properly, especially the underside of the sole. Sometimes it is very difficult for patients to look inside the part because of the arthritis. So ask someone else to have a look at your feet, or take a mirror, or take a photograph of the sole and then inspect properly. This you have to do it every day if you want to prevent complications of diabetes. Any problems like redness, blisters, cracks, and any corns, any calluses, you got to seek immediate medical help. Call for help. We are always here, and do not take any chances with your feet. Once you inspect your feet, you need to wash your feet every day. Washing feet means completely washing with a mild soap. After washing it up, pat it dry. Make especially in between toes, dry them up properly. And when I dry them up in between the toes, don't scratch it, be gentle, just pat dry all the areas so that it's not wet. And once you dry up the skin, you need to moisturize. Most of the patients with diabetes, their skin is very dry because of, again, neuropathy. Normally there is a healthy skin will have some sort of sweat. When someone with diabetes, neuropathy, this protective sensation of sweating is lost. So these patients are at high risk of dryness, and when the skin is dry, it loses its texture and it's very easy, becomes very fragile, and it cracks and breaks and leads to an ulcer. So moisturize your skin twice a day to keep it well. And when I say moisturize, don't moisturize in between the toes, because that's a very sensitive area, and that leads to more wetness with the sweat and can lead to fungal infections, and most of the problems start in between the toes. So properly dry them up and then put some powder. It could be talcum powder, or it could be candid powder, like an antifungal powder, to keep your feet healthy. And once you do this daily care in the morning, when you walk, always check your footwear. And most of the patients, they don't feel underside of the foot. So make sure that there are no stones, pebbles inside your stones, or any foreign body, because even when someone goes to somewhere, they tend to find some sort of foreign body inside, and if you keep walking on that, you don't even realize until it ulcerates. So always check inside of your sole. Wear properly fitting shoes. It's very important to do that, especially if you are diabetes. There are specifically made diabetic footwear which will help ease out the pressure areas of your feet, and that helps to prevent calluses and corns like a hard skin. Take care of your nails. In patients with diabetes, they are prone for fungal infections. The nails get brittle, hard, and sometimes very difficult to cut. If you are struggling to cut, don't cut it yourself. See a podiatrist, or see our vascular department has got a good multi-care podiatric specialty here. So we will take care of no bathroom surgeries. I see patients doing self-treatment, watching YouTubes, like putting some corn caps. Please do not put corn caps if you can help it, because corn caps have got very aggressive chemicals which tend to damage the surrounding skin, and then that leads to an ulcer. And footwear, especially when you buy a footwear, please just walk few minutes and check whether how comfortable you are feeling before keeping it. It's very important to do that. It is very, very important to take care of your feet in the whole, and any changes in your feet in terms of ulcers, do not wait. Do not wait for things to heal, over-the-counter medications that will not help. It's important that you get an appointment with your doctor to have your feet looked at least every 6 months, to check the sensations of your feet and also to look at the circulation part of it. It's a part of diabetic foot assessment. And do not wait if you think you have got a crack or an ulcer or an infection like redness. Early intervention always saves feet, toes, and that's what we are here for, to prevent limb amputations. Thank you.